You'll feel like a little bit here.
You're live, Dr. Emer.
Hey guys, come on in. Let me show you what we're doing. We have our beautiful female here today doing her rejuvenation procedure. This is still the tried and true treatment. It's called Fraxel. And Fraxel actually came out over 10 years ago. I was one of the first doctors doing the studies on the wavelength we're using right now, which is called the 1927. This specific wavelength is geared for her skin type, light skin, blue eyes, to get rid of freckling, sun damage, and pigmentation. Her skin, in one treatment, in just one, is gonna look 5 to 10 years younger with this density that we're doing right now. And what happens is you can see, you can't even see anything because this is called a non-ablative laser, you guys. That means that all the energy is going under the surface and it's not actually on the surface itself. And so all the collateral heat is going to tighten the collagen and the crunching. Do you hear that? Can you get in a little closer? Do you hear the little popping? Do you hear the popping noise? That's because the thulium wavelength that's on here attracts the water that's in the superficial part of the skin. Perfect. Okay. So you can hear that little crackling. It's like popcorning. You hear it? Hear it?
Do you guys hear that?
The cracking, that's sun damage. Now, here's the good thing, and I'm gonna give her something very positive right now. If she was bleeding in spots, that would mean that her skin is very sun damaged and thin, but right now it's not, which means that she actually has a lot of good collagen. And that's great. That means that this treatment is gonna do a lot for her, exactly. Now, we did nerve blocks to limit the pain. It doesn't get rid of it, but it limits it. How's the tolerability? I know you can barely speak, but the best that you can. What would you say?
7.
That high?
6.
Out of 10? Oh my God.
I have no.
That's still high. You were supposed to say 2 or 3.
Oh, okay.
I'm kidding. You don't have to.
No.
You guys, I don't lie. We tell the truth. This is the thing. One of my clients today said the reason they came in is because we show all these reality treatments. Like, this is the reality. The fact is, this is a little painful, but she's doing really good, and we want to keep her really youthful. That's the point. The other thing, you guys, what's a huge positive here? This gets rid of skin cancer. So if you have the risk of skin cancer or you've had skin cancers, you need to be doing Fraxel every 4 months.
Christopher says, I get one every year. I love it.
One a year? Guys, I said every 4 months. Okay, not every year, but I'm glad that you're doing it rather than not doing it. And in between, what should you do, guys? Micro-rolling system from Emer Cosmetics and our Aerify kit, because that also has acids in it that helps keep the skin really bright. So she's doing really good. Really, really good. Couple more passes here on the cheek.
What's her downtime going to look like?
This is going to be about 3 to 5 days of sort of flaking and light peeling. But she's going to be using peptides and growth factors like Refit Face and our enzymatic polish. And then she's also going to use stem cells from Anti-Age, and that's going to really help her heal. So the key is the Aftercare. She's going to look really puffy tomorrow. Perfect. That side's done. Turn to the right now. I want to show you guys something. Look at my customized goggles. Jason MRMD. Look on the other side. Let me show you really quickly. Innovative Optics. Anyone that's a doctor, because I know you all follow me, shout out to Innovative Optics. They're the best at producing goggles in the entire world. And if you need goggles, you should get them because they're the best. They're the most comfortable. And we customize these amazing ones. No one has this because it says my name on it. So she's doing really good, you guys. Honestly, I thought she was going to do worse. This is amazing. And you can hear the crackling, which means it's working perfectly. We're getting the crow's feet. We're working to tighten the under eye.
So she just had Morpheus, and this is Titan Bright?
Yes, this is what we call our Titan Bright. Thank you. Why is it called that? Because she's deep tightening with the Morpheus treatment. That's the microneedling that we just did before with radio frequency. And that's going to tighten her neck, jawline, and pull things back and up. And then the laser is going to work on the surface to brighten. So that's our Titan Bright. And this combination really, I know no one likes to do it. They hate me while they're doing it, but they love me in a week. That's what I always tell people. You would want to do this every quarter. Now, the first 2 treatments, it's better to do them closer together if you can. And then we can also add in something called BBL, which gets rid of more brown spots even than the Fraxel alone. But we can do it as a maintenance treatment too. What else are they asking?
Red Baby 4 asks, will that tighten the under eyes?
It will tighten the under eye. We could also add plasma pen, or we could do even a CO2 if we wanted. But right now we're gonna use the laser, and we did Morpheus there as well. She's doing amazing. This is a 55% density, you guys, which is really high for a non-ablative laser. That's why it hurts, but she's doing so good. I also wanted her just to get a really amazing result. I want her to look super young, like she does already, but even better. All right, last pass.
Christopher commented again and said, I do Clear and Brilliant 4 times a year.
Well, I do it every 4 to 6 weeks. You guys are underdoing the lasers, but that's good, Chris. Do Aerify microneedling system weekly, and do the Aerify mask monthly with your Clear and Brilliance in between. You can even do Clear and Brilliant on the same day you do Aerify, or even Moxie.
And where can they find these post-care products, Dr. Emer?
You can get these at emeragecosmetics.com, you know, and follow my lives. Hold on. You can follow my lives every Wednesday and Sunday.
Fraxel. Hi, honey.
No, that was our social media team. To the left. Okay, the other thing I want to say before we go off live, this is going to hurt her less, it's going to feel a little different, but is the neck and chest. It's really important to do this area. You want to get rid of a lot of the sun damage. The area here is a lot thinner, a lot more difficult to treat. The other thing that happens too, you guys know, I mean maybe not when it's cold out, but this area gets sweaty and a little wet. So skincare is very important, otherwise you can get a fungal infection on the neck, which is very common actually with non-ablative lasers. So you want to make sure you really know who's doing your lasers, because you don't want to miss that. If she were to get that and you don't catch it early, you could get scarring and pigmentation issues. So we're going all the way through. How's the pain here? I know it's tolerable.
Still
Tolerable but
a
painful.
5.
Okay, well that's better. That's better. Not like cutting your finger off anymore.
If you're interested in any pricing, make sure to DM us or email appointments at jasonemermd.com.
Exactly. So look, you guys, we're really covering the full areas. Sun goes all the way throughout the neck and chest. We're going all the way to the back.
Sad Girl Mill asks, is there any lasers for Latino brown skin? Would this work on them?
You can actually treat this on Latino skin. It just depends on what level of darkness and what we're treating. Because if you're trying to treat melasma, it's not going to work. If you're trying to treat sun damage, which you have right here, look, right here in this area, you can see that brown dyspigmentation. It's called poikiloderma. That's sun damage. This will work great for her. And even the little wrinkles by the ears. If she doesn't have a lot for preventative. Okay, turn to the right. Perfect. Look up with your chin just a little bit. There you go. A little less to the right. Just a little less. Yeah, right there. Perfect. Perfect. So that's it. What other questions they have? Otherwise, we are going to finish with the Fraxel, and then we'll do our live testimonial at the end.
Austin asks, wouldn't her face swell up really bad?
So swell up like a balloon, guys. Just for a short time period. Only a day. A day or 2 max with this. It's not going to be so bad. With CO2, it's much more. But it's all about the expectations, understanding it's not going to harm her. She can take Claritin or ibuprofen. She can take an Allegra and ice packs, and she'll be fine. To be honest, this Fraxel is very light compared to some of the stronger lasers like CO2 or Erbium, but it still has a huge impact, and she's going to look really good.
Rebecca asks, is this good for melasma? Does it get rid of it?
No, I did the clinical trials for melasma. I would not choose Fraxel for melasma. Moxie or Clear and Brilliant, and only if you're super light skinned could you do BBL. In general, you need to do peels. So Aerify and Enlighten from emeragecosmetics.com, you guys. And Clear and Brilliant is our maintenance laser for melasma. You're doing great. So that's it, guys. We're going to finish up. This is Fraxel, face, neck, and chest rejuvenation. Bye.